Alright, so we're going to start part 5 of chapter 2, and we're going to go over personal protection here. And I know we're all familiar with utilizing gloves, but I just need to state that gloves should be worn on every patient contact, regardless of age or who it is or who you think you may have. You should always use a minimum of your gloves as PPE. Both vinyl gloves and latex gloves are effective. We're using more vinyl now, like the nitriles and stuff like that, due to latex allergies. But sometimes you may have to, depending on the type of glove you have, how thick it is. If one rips, you may have to double glove depending on the situation. Sometimes on a car wreck scene where there's a lot of glass and stuff, I will double glove. But I typically don't double glove for every patient, but when necessary, I will. But you should change your gloves between each patient contact. When you're on scene of a wreck scene and you've got 5 different patients, you shouldn't be using the same set of gloves to treat all your patients, because all you're doing is moving pathogens from one patient to the next. So make sure you not only protect your hands, but you also protect your wrist and your forearms as well. If you're wearing short sleeves, you may need to wear some type of sleeve protector, arm protectors, or you may need to wear long sleeves. Now, eye protection, this is going to protect us from blood splatters, and we'll use this on our trauma patients sometimes when we've got a lot of blood going, especially arterial bleeds. Use it on childbirth. If you've got a patient who's got projectile vomiting and they're spitting, you can wear eye protection there as well. Especially like if they have a facial injury and they're spitting blood everywhere, you'll want to wear some type of eye protection. But you may also want a face shield. If you see the picture down at the bottom, he's got a face shield on because it also protects the eyes and the mouth as well, because you don't want blood and stuff getting in your mouth as well. Just remember, your prescription glasses are not adequate because the sides are not protected and the tops are not protected, so blood can come in from the sides as well. And they're not designed to be protection for blood-borne pathogens. For the most part, I'm sure you could find some that are, but 90+% of the glasses out there are not adequate. So, gowns, these provide protection from extensive blood splatter. That's why you may need to wear a gown if you don't have any protection for your arms. And like I said before, you may wear these in situations as a field delivery of an infant, or you may wear them in major trauma, or you may end up wearing them if you have a patient that has MRSA or some type of infectious pathogen that can be spread from direct contact. They're not practical in most situations, and sometimes they may even be dangerous. For instance, you don't want to wear a gown on a car wreck scene because if somebody's prying a vehicle apart and you get caught in there, it may end up pulling you in and you could end up getting injured. Or if you were in a manufacturing plant and there's equipment running, let's say if you were to go to a power plant, well, they're not going to shut the power plant down for you, because you shut down the power plant, you could risk injuring even more patients. So if you're wearing a gown in there, it could end up getting sucked into a turbine or something and you could get injured. So you want to be careful. Mask, respirators, and barrier devices. Well, this is our typical N95 HEPA respirator, and this is what we're going to wear if there's a chance of exposure to tuberculosis or other communicable diseases that are spread by respiratory. If you are going to have just the chance of splatter for fluids, you can just wear a surgical mask, because a surgical mask will stop just basic fluids like blood and stuff. This is the N95 mask is going to be used, or the HEPA mask is going to be used for tuberculosis or something that has very small particles. And it says here, do not put the HEPA respirator on a patient, which is very important because these have to be fitted. And you should be fitted at your department whenever you first go through orientation there, so that you know what size of mask to wear for that specific brand. Respirators, masks, and barrier devices. We've learned how to use these in our BLS and CPR. So we'll use these if we have to perform mouth-to-mouth resuscitation. If you do, you want to use a pocket mask or some type of barrier device that you can purchase, or use your bag mask device. Remember, after you use it, it's considered contaminated and it's best to dispose of it. So follow your local guidelines, follow whatever your procedures are. But most of the time, a bag valve mask is going to be disposed of in a red bag. Sharps. Well, the Sharps container is going to help us avoid transmission of diseases that can be spread through bloodborne routes like HIV or hepatitis. You do not want to recap, break, or bend needles unless it's absolutely necessary. And I will have a video to show you how to properly recap, but our practice is not to. So if after it's used on a patient, you want to dispose of it in a Sharps container. We don't reuse needles. Now, the only time I say it's okay to recap is like if you're drawing up a medication like Narcan and you're not quite ready to give it yet, then you could recap that. And that's an unused needle. If you were to accidentally stick yourself, well then there's virtually no risk of disease transmission there. So, but if you've used it on a patient, you want to dispose of it in a Sharps container. Make sure it's an approved, appropriate Sharps container. And that's it for this section. The next section will be going into employer responsibilities. If you have any questions, please feel free to give me a shout, and I will get right back to you. Thank you.